So good morning. My name is Jonathan Sherbino. I'm the director for MERIT, which is the McMaster Health Education Research and Innovation and Theory Center. It's a mouthful. If you don't know much about MERIT, you can find a little bit more about us at merit.mcmaster.ca. We're a community that is seeking to grow and advance a health professions education mission. We have discussions, we coach each other, we support each other, and we're engaged in scholarship around education to advance the collective mission of Faculty of Health Sciences and of the university. We're special kind of nerds, and we would welcome you to our community. So thank you for being a part of today. But I'd also invite you to think about how you might integrate and be a part and join this community and discover the many other events that we're offering over the course of the year. So you can find a little bit more about us at merit.mcmaster.ca. But more importantly, come up and talk to some of the members of the community today. One of the big goals I think we have today is not only to advance this conversation around the promise of mixed methods research, but also to build community, to build connections. And hopefully at the end of it today, you will have sparked some degree of enthusiasm for a question or a project or just an insight that you might not have had. But more importantly, you might have met somebody that can be part of an ongoing conversation and a connection and perhaps a new friend here in the education space. You're going to hear a little bit more about PSI, Physician Services Incorporated, later, but we want to acknowledge and thank them for their unrestricted educational grant to make today possible, so that we can bring in a number of speakers and host and facilitate this in a way that's meaningful for you. If you're part of the McMaster community, though, you'll know that this is the traditional territory of the Anishinaabe and the Haudenosaunee people, land that's governed by the Dish with One Spoon Wampum Agreement. And I think as we think through a conversation today about research, and we're going to talk about data and analysis, perhaps it's important for us to take a step higher up and ask whose data and whose analysis. We make assumptions, and sometimes we jump into a conversation without considering the biases or the assumptions we might have. And so I hope that part of the background reflection that we have today is understanding data sovereignty, understanding assumptions about what is appropriate or a singular approach to analysis. And that's part of the background and part of the kind of the thread that carries through our conversations, understanding that our assumptions about how we can think through problems needs to reflect traditional ideas and the work of First Nations people. Our structure today is going to engage you, hopefully, or that's at least the intent in the design. The structure is you're going to hear from our speakers, but it's not like a traditional conference where you get to drink your coffee, the chocolate chip muffin that I really think might have disappeared. But we're going to actually engage you at your tables. There are facilitators there. It's not going to feel intimidating. I hope you're going to feel welcome. But your perspective and your opinion counts. You have a lived experience. You have a way of interpretation. You have an insight that brings richness to that conversation. You may be saying, I feel a little bit like an imposter today. I don't know anything about mixed methods research. I think I might have signed up for something that I didn't quite understand what it was going to be. And I think you're going to find at the end of the day that these conversations challenge you and maybe undo some of your assumptions. They may make you say, I can see research in a different way. But hopefully you feel engaged and have an opportunity to interact with the ideas. And then we're equally challenged by the speakers that walk us through the themes for today. It's really exciting for me to introduce our first speaker. I'll probably say it's really exciting for all the speakers because I'm equally delighted for all of them. I'm not playing favorites with Dr. Guetterman. But one of the things that's really exciting about our community and about this grant is, as a community, we say, what are the questions we're interested in? And who are the people that we would like to stir us up a little bit and to challenge our conventions? And so Dr. Guetterman is an associate professor and director of the Mixed Methods program at the University of Michigan. He conducts health services research with a focus on improving quality and safety using informatics technology. But really, and from our conversations, it seems to me that at heart, he's an applied methodologist looking at general research design and mixed methods specifically. He's influential in the discipline of mixed methods research, serving as a co-editor-in-chief of the Journal of Mixed Methods. And he's authored with John Cresswell the 6th and 7th editions of educational research, planning, conducting, evaluating quantitative and qualitative research. And if you have a copy here today, I'm sure he'll sign it for you. But you'll have to see me, his agent, so make sure that we get through the time. You've heard enough from me, Dr. Guetterman.
All right. Thank you, Jonathan. Can you hear me okay? All right. So I'm Tim. We'll go through my spiel here. I'm going to talk about visuals and mixed methods research, and then we'll switch gears a bit, and I will ask you to produce something in small groups, to produce a visual like we're talking about. Here for questions as you go through that, but I always think that it's helpful when doing any research, certainly when doing mixed methods, to keep the end product in mind. And for a mixed method study, one of our end products is integration. So with a mixed method study, we are combining qualitative and quantitative research methods. We're bringing the two together in order to learn something more. And that's really my focus today, how we can use visuals in order to learn something more. So our goals here are to define joint displays, which is a visual technique, to relate joint displays to different research questions. So think of how they can be used to address a research question. And then also how they might fit with some of the common mixed methods designs that we use. So I've mentioned already that mixed methods is this idea where we're bringing qualitative and quantitative research together, and they become really interdependent with one another. At that point, we're intentionally collecting, in most cases, both quantitative and qualitative data. Part of what that does is it leverages the strengths of those two approaches. It also, might be a way to minimize some weaknesses. So obviously with quantitative methods, we lose voice or depth, for instance. So we can have maybe the best of both worlds through a mixed method study. But when I think of integration, at its core, this critical idea, defining feature of mixed methods, it's generating something new. Just simply, there's something new that comes out of integration. And that can mean a couple of different things. It could mean that we're generating follow-up studies. So perhaps we're starting quantitatively. We're using those quantitative results in a systematic way. So that's integration in order to plan that follow-up qualitative study. That could be things like, what questions do I want to ask in an interview or a focus group? It could also be things like, who do I need to sample? Who do I need to talk to in order to best address my research question in that qualitative follow-up? It could also generate new instruments. So a common example here is that we're starting from more of a qualitative perspective. So we're going to explore first and then use those results again in a systematic way, integrating in a systematic way to develop surveys or measures or instruments, for instance. And then finally, I think that really all mixed method studies should generate meta inferences. And meta inferences, it's this jargony term we use often in mixed methods. You don't have to use it. Meta inferences are really mixed methods results. It's the result of an integrative analysis. So to give you just a brief definition of meta inferences, and we'll get into it more, but these are the results from integration, the results from integrating either results, so bringing qualitative and quantitative results together, or from integrating data, perhaps integrating raw data. And really, these meta inferences are new insights, or someone call them new claims or new conclusions that we would make. And they're new because it's something we wouldn't learn had we kept the quantitative and qualitative results separate from one another. Before I get too much farther into this, I just want to go back, and I'll show this again later on, but I did attempt to put a QR code to these slides here. If you are interested, feel free to take these. I'll show some templates for these visuals. Full permission to use all of those, adapt them, do whatever you want with them, do something more creative. If for some reason that doesn't work, you can also email me, and I'm happy to share these slides as well, okay? All right, so on to where we were. I'm following in many ways an article, and I just share this with you here. And it's really on, we call it Designing for Integration in Mixed Methods Research within BMJ Quality and Safety. So if you want a reference for any of this stuff I'm talking about. But what we write about in this article is keeping integration at the center of a mixed method study. So, and we can do that across many levels at the level of the research question. So writing a research question or an aim or objective that really speaks to the need for integration, what you hope to learn from integrating. At the design level, so thinking about mixed methods design, so what you're doing for the qualitative portion of your study and the quantitative portion, and when and where and how they're coming together. And often that is in multiple ways. At the methods level, so when I'm talking about methods, I'm thinking of more procedures, methods, techniques of, say, data collection and analysis. So when I'm using the term method, I might be referring to things like conducting an analysis of variance or a thematic analysis, for instance, or semi-structured interviews or surveys. The results level, which you see next, so these are the results of our analysis. You have, say, quantitative results, maybe it's p-values and coefficients, descriptive statistics. Qualitative results, it could be themes, for instance. So at a results level, how are we bringing those results together? How are we integrating to learn something new? And then finally, during interpretation and reporting. So again, the onus is on us when doing mixed methods research to report those integrated results. Today, I'm really going to focus mostly on the results level and then also the interpretation and reporting level because we'll get to some of the visuals as well. Okay, so in terms of integration at the results level, and that's really where I'll focus from this point on, I really think of integration in a couple of different ways. But I think of the hallmark, it's hard to see this up here, the hallmark of a good mixed method study is the use of merging as a technique. There are other ways to integrate, of course, too, but merging is this idea that we're bringing qualitative and quantitative results together, again, in a systematic way to generate those meta inferences. And I'll distinguish a couple of different types of merging as I think about it. I'll talk about comparing results and show you through this. We'll spend a good chunk of time on that. And then also relating results to look at patterns. And when I say relating, I mean something like themes by statistics. So looking whether there's a pattern between those two. Again, for this goal of generating meta inferences. So again, integration is leading to something new and merging integration leads to new meta inferences. So for example, that could be things like learning intervention benefits or perhaps the outcomes of an intervention along with the experiences of participants who went through it. So you have training, for instance, and you can, of course, measure that with pre-post, but then we can also bring in, how does the experiences of participants maybe explain some of those results? Outcomes and process. And these are just a few examples. There's many, many others, but this is also a really important one. So we can look at outcomes, and by outcomes, it can mean the outcomes of an intervention, but it could also mean just general outcomes. So a study that I'll probably talk about a little bit is looking at in-hospital cardiac arrest survival rate. So think of that as an outcome, for instance. So can we also integrate process to try to explain variation in survival rate? So process within a hospital, within a team, how the system is structured, how training happens within that organization. And then finally, just this idea of explaining variation, explaining quantitative variation. And again, these are just a few examples of those types of meta inferences, just to get you thinking a little bit about some of the possibilities. So I'll also just touch on integration at another level because we'll focus on this as well, and that's during interpretation and reporting. So historically, and I'm thinking about a mixed methods manuscript, integration was reported in more of a narrative way. So kind of weaving together quantitative and qualitative results. So we found this change was statistically significant, and here were some of the experiences of people and major themes, and this is the meta inference that generated. And that's completely fine. I actually believe it's okay to do mixed methods without visuals, without a joint display. But an alternative way to develop those meta inferences are through joint displays. I'll spend a lot of time talking about these, but these are a visual technique to achieve integration. And software can be really, really helpful, in my opinion, for integration and for joint displays. You don't have to use software, but it can be a really helpful tool. The software are traditionally qualitative programs that have added mixed methods features to them. So some common programs are NVivo, Deduce, MaxQDA, QDMiner. There are a lot of programs available that have some mixed methods features within them. So I want to talk about these kind of two different types of integration and really two different types of integration through merging. So merging, again, I think is really a marker of a good high quality mixed method study. I think it's always important to remember that you will not know what you're integrating, of course, until you have results, until you have data, certainly, and until you have results. So at a planning stage, we can think about planning if we're designing a study, what types of integration strategies we might use. I think it's important to anticipate, but all of that is a little bit flexible and subject to change once you actually have data that you can work with. So starting with merging through comparison, and again, excuse me for a moment. I will talk about merging through comparison, or comparing and then merging through relating. So if we're merging through comparison, the idea is that we're bringing together qualitative and quantitative results in often an iterative way. So an analogy here is this spiral thing that you see, where you're going back and forth between numbers and stories and statistics and themes, for instance. In practical terms, what that could mean in an iterative way is that you might be conducting thematic analysis and you're starting to see some patterns, and you might go back then to your quantitative data to look at it in a different perspective. Maybe you're going to run another test. Maybe you're going to look at your descriptives a little bit more. So it often is this back and forth iterative process that happens. And the reverse could also be true as well. So there are some times where we might have our quantitative analysis and it leads us to go back to our qualitative data. So it can give us a lens to look at things a little bit differently. And then through this comparison, this idea of comparison, we ultimately have quantitative results and qualitative results, and we can put these together side by side, if you will. And through that, there's a couple different things that can happen. For one, determine whether these two forms of results confirm one another, contradict one another, or sort of expand your understanding, meaning you're getting a more nuanced understanding. I think what's most important, though, is using that to develop meta inferences. So what is this new insight, this new claim or conclusion that you generate through this comparison of the two? Now, that's all, fine from a conceptual level, but we'll get into some more specifics a little bit later on as far as what that could look like. But I first want to talk about this other way of thinking about merging, and that's through relating, looking at patterns. So for example, we can look at qualitative themes by statistics or by statistical groups. This is kind of like a crosstab or a contingency table, to give more of a statistical example of this. And that's what you see in this visual right here. So this is a crosstab. It's a screenshot from a software program called MaxQDA. And I just want to tell you a little bit about what this is so you know how to interpret it. This is from a study I'll talk more about in just a few moments, where we had a randomized controlled trial to compare a virtual human simulation intervention with more of a standard computer-based learning module for empathic communication. So teaching, communicating with empathy and demonstrating empathy. These columns here are our primary outcomes. So this is from what's called an OSCE, an objective structured clinical examination that was done at post-test. So that was the primary outcome of this. And ultimately, individuals fell into a distribution. And that's what these columns represent. So we have the low performers, kind of the middle, and then the high performers, those who did really well in an intervention. These rows are qualitative codes. So these are codes that were applied to a data set. And the qualitative data here was from a written reflection, about a 500-word written reflection that everyone in the intervention and the control group participated in. So this is, getting a little bit into the weeds. We'll look at kind of a zoomed out example of this in a little bit. But this is what I mean by looking at patterns, for instance. So are there patterns? Do we see some patterns in terms of the low versus the high performers? What's coming up more or less often? Now, there are different sizes of these groups, so that's something to take into account. But for me, this is an important way of this relating for integration, important initial point. What then I think is most interesting is each of these numbers represents a number of coded segments. So I can see here we had this code lacking information. I think that's what I'm looking at. And it was 5 times in the middle performers and 5 times in the high performers. So what I would do, my next step, is I would look at those 5 segments of text and then think about and analyze it. Are there any patterns here? Are we seeing similarities or differences in these groups? So this is the idea of relating. It's kind of like a crosstab, but again, we'll get more granular as we go through this. So I want to talk about visuals a bit more broadly. There are different types of visuals that we can use in mixed methods research. So there are visuals such as procedural diagrams, where we can draw out a map really of our research design when we have qualitative and quantitative pieces. Another really common type of visual are joint displays. And I define joint displays very broadly. This is a very broad term. Bring quantitative and qualitative approaches together through visual means. So approaches, again, this is chosen with intentionality. Joint displays could be at the level of methods. It could be at the level of actual raw data. It could be at the level of results. But it's using a visual to bring qualitative and quantitative elements together in a systematic way to draw out that something new that arises from integration, such as those new insights, the meta inferences. I like joint displays because I think it gives us a framework to integrate and really to think about integration, which is just a cognitively difficult process. And we'll look at just some simple tables and matrices that try to break this down and give us a way to bring to put quantitative and quantitative results together. These are increasingly used in manuscripts, in dissertations, in other reports. We even put mock-up joint displays in grant proposals that we write, and I see that more and more often. You're not held to any of that, of course, in a grant, but it's demonstrating to the reader, I have thought about integration, and I do have a plan to integrate for this particular study. So that's what a joint display is. When I think of different uses for joint displays, I'm focusing on using them for more analytical purposes. So at this results level integration, at the end of this slide set, I have some other types of joint displays for more planning purposes, if you will. So, going from an initial quantitative phase to a qualitative follow-up and vice versa. But here I'm focusing on joint displays for more analysis purposes. One way that I like to think about a joint display is that it's addressing a research question. And you could possibly even have more than one joint display in a research project if you have different types of questions or you need to split it out a little bit differently. So I will go through 4 different types of research questions that you could hopefully address or partially address through joint displays. The first would be using it to compare qualitative and quantitative results. So really this idea of comparing. Relating qualitative to quantitative results. So again, looking at those patterns. Explaining, so this would be more in a sequential study. So using a joint display to show how your qualitative follow-up phase is explaining some initial quantitative results. And then the flip of that, more of this generalizing use of a joint display. So for example, starting qualitatively, perhaps you develop a grounded theory model, and then we're moving to a quantitative phase to test that, see if it holds or generalizes with a larger sample. So it's a different purpose. So we'll look at joint displays through those different purposes. I want to just first show you an example of joint displays. Throughout this, my goal is to show you an example and then a template that's stripped of details that you could use to develop that type of joint display. But first, I just want to share this example. This is a joint display comparing results to explain intervention outcome, or I wouldn't say explain, to understand intervention outcomes. This is the study I mentioned a little bit earlier. This was a convergent design, so meaning it's kind of a single phase study. We have quantitative data collection analysis, qualitative data collection analysis. We're bringing the results together for a more complete understanding. That's the overarching intent. So this was a randomized controlled trial, again, of this virtual human intervention relative to a control group. There were about 410 participants. This was at 3 medical schools across the US. So it was a multi-site study. Our data sources included program scores. So as individuals interacted with this virtual human, it would score them essentially based on their responses. So the idea is it would present a scenario. You have to tell someone that they have leukemia, for instance, who's presented to the ED. And then it rates you based on your responses, if they're more or less empathic, and it sort of adapts based on your responses. Just to give you an example. Another outcome, again, was that OSCE. That was the primary outcome in this study. We also had attitudinal scores, and then we had qualitative observations, and then also student reflections. And we merged, I'm going to show you merging results from an attitudinal survey. We'll look at the outcomes version a little bit later with the qualitative reflections. So this is a joint display. It's organized by domain. So this is what I call a side-by-side joint display. It's just juxtaposing qualitative and quantitative results next to one another on, in this case, a common domain. These domains were qualitatively derived, actually, and this is just an excerpt from the joint display. So we have domains related to verbal communication, nonverbal communication, the engagement of the training, and then it continues on a little bit later on. Within this joint display, we have 2 big columns, one for the intervention group and then one for the control group. And then finally, we have a column for our mixed methods meta inferences. So putting this together, what more did we learn? Within the columns for the intervention and control, we have side-by-side comparisons of quantitative results. So these are descriptive statistics from an attitudinal item, from a survey item on an attitudinal survey. And they're juxtaposed side by side with qualitative quotes, illustrative quotes. Now, we'll look at other examples that don't have quotes. It has more of an aggregate, like a summary of the theme, for instance. But this example has quotes in it. The idea here is that as an analytical technique, so for you as the researcher, this is helping you compare related qualitative and quantitative results to develop meta inferences. And it's a format to organize this so that you're comparing on a common domain, okay? So for this first one up here, I'll go to the middle one, nonverbal communication. I had a follow-up NIH study that was focused on the nonverbal aspects here. So we see here for the intervention group, their attitudinal score was 5.13. This is on a 6-point scale. For the control group, 2.34, much lower. And then if we look at some quotes for the intervention group, they noted effective communication involves nonverbal expressions. We really didn't hear anything from the control group. They sort of forgot about nonverbals. So putting this all together into this final column, and I think I'm losing, here we go. The mixed methods inference, so I'm at this middle portion of the final column. Intervention arm comments address the value of learning nonverbal communication, and the difference was confirmed by the attitudinal scores as well. So that's, again, putting it all together. So this is one type of a joint display, but let's look at several different types and try to connect these to research questions that you might address. So this is just kind of a recap of the 4 different question types that I mentioned earlier. These, just to be clear, are, these are terrible research questions. These are very broad. These are vague. Don't use these research questions. If you use something like this, tailor them to your study. So this is more of a template to think about it. But you might have a research question that's focused on comparing. So how do the thematic results and survey results compare to one another? Or maybe it's more of a relating type question. So what qualitatively explains variation, or what distinguishes higher versus lower scores? Or what do the qualitative results explain? So not necessarily a variation, but more of a general explanation. And then the last one is more of that generalization example. So to what extent do the qualitative results generalize when then tested with a larger quantitative sample? So let's look at a couple of different types of joint displays to address these research questions. Most of this is really focused on 2 types of joint displays, a side-by-side comparison, which you just saw, and then in a moment, we'll look at a themes by statistics joint display that's really more of that relating idea. So looking at some of those patterns between themes and statistics. So comparing. So comparing through a joint display for analysis. This is a way to visually compare on a common domain or on a related domain using something like a table or also a figure to do so. So here is a side-by-side joint display. This is an educational study by Haley Love and Catherine Kaur in the US. And they were focused on inclusive educational practices for children with disabilities, developmental disabilities. So in this side-by-side joint display, we see that it's organized by domain, and that's what you see up here in supports. Next to, or for that for that domain, they then have next to one another compared a quantitative score and then some illustrative quotes as well. So for the quantitative score, they're giving you first what this comes from. So this was an inclusive practices measure that they were using, and they focused on monitoring children's learning. They gave it a score of 2, and then here are some example quotes. Putting all of that together then to generate meta inferences. In this joint display, you actually don't see meta inferences. Instead, they're discussed in the text of this study. But it's a really nice example of a joint display. In terms of the analysis process for creating this type of side-by-side joint display, your first step really is to analyze. So conduct a qualitative analysis of the qualitative data and of the quantitative data. And then we kind of need to summarize the results. So that could be themes. It could be a summary of themes. Quantitatively, it could be a list of what the key findings were, or maybe it's organized by hypotheses that you've tested, for instance, or maybe it's organized by major constructs measured on a survey or some other measure that you're using. And then step 2 is to use that in order to create a joint display. So actually start to put together related qualitative and quantitative results, starting with developing a simple table or a matrix, for instance, linking related qualitative and quantitative results, and then conducting the analysis to really compare the two. Step 3 then is to interpret, so compare those to develop those new insights to generate meta inferences. So at that point, you have a joint display, write a little paragraph or two about it, and there are your mixed methods results. It's pretty simple, right? It's kind of oversimplifying, but I do think that a joint display makes it a lot easier to organize your results section in a mixed methods manuscript. Sometimes it's people come and they're like, I have so much data, I don't really know how to tell this story, how to put it together. If you have a joint display, that can become an organizing principle for writing up mixed methods results. So it can, I think, go hand in hand and facilitate that process a little bit. So one of the first steps in that middle phase I mentioned was to link related qualitative and quantitative results. Now, this is the idea of taking an inventory of your data or sort of cataloging what data you have. So think about what are your qualitative results or perhaps major domains. And this can all be organized by a theoretical framework or conceptual framework if you're using one of those. How are the results organized? Are you looking at this by theme or is it maybe by case, for instance? It always depends on your study, your research questions. What are your quantitative results? And again, it could be domains. So it could be organized by hypothesis or major constructs. You have lots of options here. And then finding commonality between the two. A very simple exercise that I recommend all the time and teach all the time is to just create a basic table and draw lines connecting related qualitative and quantitative results. So that's the idea here. What are these connections between qualitative themes and quantitative constructs? On the outer columns here, I have qualitative sources and then quantitative sources. This is just where your data come from. That can be really helpful, especially if you have multiple data sources, just to think through, okay, what are the main things I learned from this survey? What do I have from more organizational data, and so on. And then list qualitative themes, list quantitative constructs, and then connect them with lines. So apologize in advance. There is something weird when I go from my Mac to a PC where it leaves out the lines that I have drawn connecting these. But this is a sort of a creative process. The idea is to just look for commonalities and really just draw a line linking the two. So here we had a theme. This is a study. I'll show a joint display in just a moment. We're looking at virtual care and equity issues in primary care. So virtual care presents both barriers and facilitators to equity for patient subpopulations. And then connecting that to specific measures we had. So we had this measure on communication aspects. We had, in this case, it was providers rate how communication was affected for various subgroups. If there's a line connecting the two, that's a point of integration. As a caveat, in a mixed method study, you don't have to integrate everything, in my opinion. It is completely okay if this looks messy, you have qualitative themes connecting to multiple quantitative constructs and vice versa. Often we'll have themes that don't have any related quantitative measure. Again, that's okay. Part of the nature of exploring qualitatively is that you're learning new things you did not anticipate. So not everything has to connect, but when you have a line that's connecting, that again is something that you could then put into a table or matrix, a joint display. What we did was we decided to have really just this basic bar chart, if you will, showing our quantitative results. And this is asking, it was one question about how communication was adversely affected for various populations of patients. So that's first here, that's the first column. And I should say this was an explanatory sequential study. Then through the follow-up interviews, it was putting together some of the related qualitative results. It's just organized by a little header. So patients with limited English proficiency, barriers exist like access, follow-up to visits, and then finally the meta inferences column. So putting all of that together. So for the top one, physicians generally noted more frequent adverse communication with non-native, non-English speakers, and the qualitative results clarified what specific barriers the technology presented. And in the paper, it goes into more detail about what those barriers actually are. So here is a template for creating a side-by-side joint display. Again, addressing this broad research question, how do the thematic results and survey results compare to one another? It can be organized in any way you want. I have this organized by theme. It could be by domain. It could be by a quantitative construct. A column for qualitative, a column for quantitative, and then a column for the mixed methods results or inference. Within the cells here, qualitatively, you could have a descriptive summary of that theme, for instance. You might also have some illustrative quotes. Quantitatively, a summary of results that are related to that theme. And then finally, summarizing the meta inference. And you could also note, if it's important to you, whether there was convergence or divergence between the two. So analytically, it's sort of this process where you have a domain or theme or construct. You're putting things in this visual to facilitate a comparison between the two. It's just breaking down your results and then using that to generate those meta inferences, okay? All right, relating, I'll go through relating and then we'll kind of quickly go through the other types because it's really just using these same structures. So relating through a joint display for analysis, things like themes by statistics or vice versa. It kind of looks like a crosstab, for instance. So here's a joint display. I'm back to the study of virtual human technology. Within this paper right here, this joint display, we were focused only on the intervention group. And there was a clear distribution for the intervention group. So that's why you see columns for low performers, middle performers, and high performers. And this was based on our primary outcome, this objective structured clinical examination. The themes then, so looking at the patterns, and this is just an abbreviation of the theme to fit it in the joint display, are as rows. And within the cells here, illustrative quotes. Alternatively, this could have been a summary. And I won't go through all of this, but it was really a helpful analysis to conduct. And I used MaxQDA software, one of their tools called a segment matrix, to do this analysis and then did the joint display. So we had this theme that was related to motivation to learn more. For the low performers, there were really no related qualitative comments. For the high performers and even the middle, we have one illustrative quote. It would be interesting to go through other scenarios to see if this actually has a positive effect on my future interactions with patients. You know, it seems obvious, of course, but doing this analysis really kind of, confirmed this. And it said to us that there's a group of people who are clearly missing with this intervention. So what do we need to do differently? Do we need to screen them out? Do we need to instead do some initial work to sort of activate maybe prior knowledge or explain the importance of communication, maybe reinforce that you're much more likely to be sued if you have poor communication, get into some of those details. So it really is helpful for thinking about the next stage of this intervention. But that type of analysis, or that type of finding, we wouldn't have really known had we not gone through this type of analysis and conducted it. So steps in creating this type of joint display. First, of course, analyze your qualitative and quantitative data. And then we do need to have some kind of category. So in the examples you saw, it was categories of quantitative groups. Could be high versus low scores. Maybe it's those who experienced change versus those who did not experience change. You can choose here based on your questions. And then create the joint display with quantitative groups as columns, qualitative as rows. And then in the cells, you could have perhaps a summary, maybe some illustrative quotes to examine patterns. So, and that's where I want to just kind of go to the template and the example of how I think it's helpful to look at patterns. So in this template, I have a column for higher, middle, and low performers, and then a column for the meta inferences. And then I have rows for the themes as well. And then a final row for meta inferences. So analytically, though, this process, and this is just a simplified version, thinking about a particular theme, comparing higher versus low scores in that case, and noting, is there a pattern here? Is there a distinction or not between the high and low performers to generate meta inferences? But then also looking down these columns. So thinking about, for higher scoring individuals, is there a pattern of themes that we see, for instance, again, to generate meta inferences? Almost a profile, if you will, of higher versus lower performers. Both of those analyses could be really helpful, really interesting, of course, depending on your research questions. So the next couple I'll go through quickly because it's largely just a repeat of the same types of joint displays that we've seen before. But for one, explaining quantitative results through a joint display for analysis. So this would be more of a sequential study of a quantitative phase and then a qualitative you're using to explain those initial results. So for example, my research question could be related to, how do the qualitative results explain variation, or how do they expand on your quantitative results? Here's an example by Shane Haynes Brown. It's a really nice study. It's from education, and it's focused on the use of technology, essentially, in the classroom, and technology as tools. This was a case study, so keep that in mind. On the left-hand side here are quantitative scores. So we have different measures related to lesson dynamics, technology as tools, and each one of these bars represents a different case. It's juxtaposed side by side with qualitative. In this case, it's field notes that are summarized as well by lesson dynamics and technology as tools. So those same domains we saw on the right-hand side. And then finally, the interpretation, or these are the meta inferences on the right here. Note there's also some color coding so that it's facilitating the comparison between the quantitative and qualitative results. But again, a really nice example of a joint display. So the template looks exactly like the side-by-side joint display that I showed earlier, with just one exception. And this is my, I don't know, weird obsession, but I try to follow the flow of procedures in the design. So this is an explanatory sequential design. So I have the quantitative column first, then qualitative, and then the mixed methods interpretation. You don't have to be that particular with things, but that's why I have the template set up. So then finally, this idea of generalizing, just in our last couple minutes here. So this would be in more of, say, an exploratory sequential design, a qualitative phase first, then a quantitative to test those results. So this is the interpretation that happens after that quantitative phase. Questions could be, to what extent do the qualitative results generalize or hold when tested with a larger sample? And this rotated, so I'm sorry about this again. So this, yeah, it's going to be kind of hard to explain. This is a side-by-side joint display. You kind of have to turn, or if you download it, it'll hopefully appear better. This is it's a study by Minyoung Shim. She was looking at mechanisms of an intervention for dance and movement therapy, and her initial phase was grounded theory. This was developing a model, a theoretical model of the mechanisms of change, if you will. So within this joint display, she has juxtaposed side by side, and you can barely kind of see them, the qualitative themes in quotes at the bottom here, her qualitative results. And then at the top here, normally on the left-hand side, that would be her quantitative results from measures. And then down the middle, so this is a slightly different organization, she's noted whether they were congruent with one another or not. So it's more of kind of building to, sometimes called pillar integration, so kind of building to the middle. But it's facilitating this comparison in a very similar way to what we've seen in other joint displays. So I'll just jump to the template right here for this. Again, this is just a side-by-side joint display template, with the slight exception that we have the qualitative column first and then a quantitative column, and then the mixed methods interpretation. But this is where you could get to meta inferences that are around issues such as whether the qualitative results did hold or whether they were supported, or even a more sophisticated question such as how might I now revise my original grounded theory model based on these quantitative results. So lots of options. I've shown really just kind of two basic templates, the side-by-side and the themes by statistics joint display. But I think it's a good starting point in order to develop joint displays in mixed methods research. And again, the analytical process is just like a side-by-side joint display. So I want to emphasize a couple of things here before I wrap up. For one, I have shown several different joint displays. These are all the end product, the published product. What I think is really cool about joint displays is as you are putting this together, as you're populating this, organizing your results, putting things side by side, in my opinion, that's really conducting integrative analysis. So I think a joint display is really an analytical technique in addition to a way to present your results for the reader in a way that they can hopefully understand and see how you arrived at the meta inferences. But it is iterative. I can guarantee you all of those versions went through multiple iterations before arriving at what you saw. Always consider your design and type of integration. And I think it's really helpful to create a mock-up joint display for any research study, just to, again, keep that end product in mind and think about integration. And I'd like to shift gears and move to that. Do you have